Welcome to Schweitzer Drive, a podcast where we explore what goes on between the generation of electricity and the light switch. Join Dave Whitehead as he interviews the entrepreneurs, innovators, and experts who are inventing the future of electric power.
I'm Dave Whitehead, and welcome to Schweitzer Drive. Today, we're focusing on healthcare, which might have you wondering, how does that connect with our theme of electric power? Well, the electricity we expect when we flip a light switch doesn't get there by accident. Over 3 million Americans report to energy industry jobs each day. We depend on those folks to generate, transmit, protect, and repair the flow of electricity in our homes, businesses, hospitals, and data centers. They depend on the American healthcare system to stay healthy and capable of carrying out the vital roles in society. So what can be done to ensure employees like these have access to affordable, clear, and stress-free care? SEL Senior Director of Health and Wellbeing, Michele Beehler, is here to share some great examples from her team that focus on exactly that. Michele graduated from Purdue University with her BA in Law and Society, and she served as a human resource manager in the healthcare, manufacturing, and transportation industries over the last 20 years. She joined SEL in 2012 and currently oversees our global benefits, health clinics, child care centers, gyms, and is a member of our SEL ESOP committee and 401k trustee board. Michele also participates as a member of the Employee Advisory Council for Premera Blue Cross Blue Shield of Washington and is a member of the Tri-State Health Memorial Hospital Board. Michele, thanks for being here, and I'm excited to dive in. Will you please describe your role and the goals of your team here at SEL, and how did all this get started?
Well, thanks for having me here, Dave. It's exciting to be here talking with you about healthcare. As you said, I oversee our OnSite health and well-being programs. And in addition to that, that group has professionals that are basically caregivers to our employees and their families.
Ooh, let's roll back a little bit farther. So SEL's been in business. This is our 40th year. What we're known for is electronic assembly and manufacturing and engineering services. Why would a company like ours even have a healthcare system on site?
Great question. And it kind of starts like most things at SEL. It was an idea that Dr. Schweitzer had while he was visiting a aviation company. He was touring and they had an on-site well-being gym, and he saw employees working out during their lunch hour, excited to be there, going back to work even more engaged. And he thought, what a great idea.
A gym is a big jump to having a health clinic, though.
Well, we started with a gym, and then from there, a couple years later, we actually became self-insured. And essentially what that means is we pay all of our own health bills up into a certain point where we have a stop-loss insurance. And because of that...
Why would we want to do that?
Essentially, it creates... Well, depending on your total population, it could be less risk, and it typically is much cheaper to do.
Great.
So if you're not self-insured, someone else is determining how much you have to pay instead of paying the actual costs.
Okay.
So we became self-insured, got interested in, well, how else could we help provide healthcare and keep our employees healthy? And by one of those ways was doing an on-site health clinic. We started in a small first aid room, and it was really tiny as an experiment.
I remember those days. I went up there. I was traveling, to South America, and I need yellow fever shots. So I rolled up there, and they gave me a shot my whole experience lasted like 10 minutes, which was fabulous.
Yeah. Quick, convenient.
That was years ago, though.
Yeah. We started in 2013 with that clinic. And like I said, it was an experiment. Only employees could go there. And the line was typically out the door because so many people love the convenience of it. And, say I have a sore throat or my ear hurts. Like I can go and get it taken care of for no additional cost and go right back to work.
That's great.
So we expanded that in 2015 and opened it up to family members. And then in 2017, we put another facility in our Lewiston site.
So what kind of services can you do on site?
We have a full primary care. We can also see peds, so pediatrics. We have physical therapy, mental health counseling, and last year in 2023, we added some on-site pharmacy.
Where do you all draw the line? We will do this, we won't do this. And I'm sure there's some kind of financial sense that it makes for part of your decision process.
Yeah, so we do an analysis of what are the things that we refer out every day to other specialists and providers. And each year we look at that and say, what makes sense to bring in-house that we could do even cheaper, faster, with higher quality.
Now, is it the sole reason to have an on-site one is well, a lot of things have to do with cost. Are there any other benefits besides just strictly the cost thing that gets your team excited or how you provide, I guess, value to the rest of the organization?
It's not strictly cost. I think that our on-site health centers, well-being centers, even childcare facilities are probably our most talked about benefits. Employees love having the access to them, sharing with their family members the access to them. And I've even heard people talk about like our childcare centers, for instance. I don't have children or I didn't have the opportunity to, but just knowing that my coworkers have that opportunity makes me proud. And so it's driving retention. And I think it's also getting new recruits coming in too, because it's unique and different and exciting.
Well, in full disclosure, SEL Health Clinic is my primary caregiver, so I should disclose that. In your time in healthcare and well-being, how have you seen the healthcare system and all that it takes to navigate it affect employees?
So healthcare, just like the electric power industry, is very difficult to navigate. And it's one of the things that we each as individuals interact with on a day-to-day basis. The thing with healthcare is when you think about when you need healthcare, if you're not being, going just for your annual wellness exam, you're typically not feeling well. Or maybe someone in your family is not feeling well. You're not in the best of spirit. And then you have this complex environment that you have to navigate. And it's hard. It's hard for employees. Prices are not transparent. And we have been conditioned by insurances and by the healthcare industry to not ask questions about our care. All we care about is how much is my copay? How much is my deductible? Nothing else. And that really has driven us to a place where healthcare prices are crazy, skyrocketing, and we're all ordering off of menu with no prices.
And you don't have to pay it right then and there either, right? You're in the emergency room or something, and all you're thinking about is, I have a sick kid, so do whatever you have to do, and the bill shows up sometime later with all kinds of codes that, I'm not a very smart guy, but it's like, I think I can do some level of math, and I can never figure out any of those what do they call it? EOBs, explanation of benefits or something to that effect.
Yeah, nobody wants to go collection, so you pay it, right?
Yeah. What else do you do? That's the price. But you all have worked really hard to dig through all the various layers of the process of healthcare. Maybe that's the best way to say it. Will you talk about some of the successes you've seen that from the work that you've done, and what kind of impact does that have?
Yeah, happy to. Lots of examples come to mind, so I'll try and narrow it down. On a day-to-day basis, our health, well-being, and benefit teams members are walking employees through anything from, hey, my wife just had surgery and I need a physical therapist in my area, helping them find someone close with high quality, good pricing, all the way to, like I said, last year, we just added pharmacy on site. Myself and Dr. Michael Stamper, our pharmacists, were going around doing some presentations to employees. He had an employee come up to him afterwards and say, my wife's on this medication. We're paying about $2,800 out of pocket, and we're broke.
$2,800 a month?
$2,800 a month.
My goodness.
And he said, can't pay for my groceries, can't pay for my electricity anymore. I don't know what to do. So Mike worked with him, did some research, found that drug had recently had a generic come out, and that's why the price had gone up so much for them. He found that generic on Cost Plus Drugs, Mark Cuban Cost Plus Drugs online retail pharmacy, for $10.80.
So going from $2,800 to $10
for the employee. And then on the opposite side, it was costing SEL $6,200. So a total savings for the employee and SEL of $114,000 a year.
So that, I don't know if that's, on the high side, if you will. Maybe it is. Maybe it's, you guys do that kind of stuff every day. I don't know what the cost of medicines these days, but what would a typical kind of savings would we see each year or something like that from the activities that you're doing to really dig into prescriptions and drug prices?
Yeah. So when you think about medical care, the average procedure has a 600% variance in price between one facility to the next. So that's just medical procedures. The average generic drug is usually marked up over 1,000%.
Wow.
That's a lot.
That's some good margin right there,
yeah.
Right? It's like, oh my goodness, I'm in the wrong business, I think, if all I wanted to do was make money.
Well, we're in this business now.
Well, you know what? You're absolutely right. So it's been great to see these wins for our employees, their families, and our company. But I know there's still a lot more work to be done. Will you discuss some of the challenges that employers and individuals are facing when they navigate the world of healthcare? It's like, I just think of myself, right? It's, how would I go about it? It just seems so daunting. I kind of just think about throwing up my hands. It's like, oh, whatever my doctor tells me to get, that's what I'm going to go get out of the pharmacy or what have you.
Yeah. The challenges that we see, again, outside of just prices being so widely different between facility, between doctor, between procedure, is it's not transparent. As a company, we offered, starting in 2021, a service called Healthcare Blue Book, which gives our employees and their family members access to a database that not only gives price information and ranks it red, yellow, green, think stoplight, pretty easy to follow, but it also ranks the quality. And that's not the bedside manner and how you and I rate that provider. It is how they actually do on the procedures that they provide. So how many readmittances, how many deaths do they have? Reportable incidences do they have? So that's how that quality.
How are employees using it? And what I mean by that is that SEL Blue Book, is that people are really flocking to it? I when I first heard about it, it's like, that's interesting, but who's going to do their homework before they need to go do a surgery or something? Again, if my doctor told me to go to our local hospital, I'll probably go to my local hospital and I'll pull up the Blue Book, recognizing there's a couple of other hospitals around that I might be able to have that procedure done at.
Yeah. So we have done some things to our plan to engage employees more, in which they have a little bit more skin in the game with their procedures and their deductibles. And with that, we see about 40% participation on Healthcare Blue Book. And the average book of business that Healthcare Blue Book sees is 5%. So our employees are engaged.
That's incredible.
And our staff, our health, well-being, and benefits members are fully trained in that. Our doctors are trained in it. They can sit there and just look it up right with you. So if price is something that's important to that patient, we can help them right then and there.
So medical costs, whether we're talking about procedures or drugs, very, very expensive. And we're pretty fortunate that we have a health clinic. For the folks that are listening to this, it's like, well, Dave, you're lucky because you have one. But, what do I do? Throwing up their hands in despair. Maybe any advice or recommendations for them?
Yeah, I think the biggest thing is ask questions. Anytime your provider is recommending a prescription or a procedure, ask why. What are you going to gain from the outcome of those tests? Does that medication, does it have a generic equivalent? Does it have a cheaper version of it? Just asking questions and being your own advocate. And then what I really think is important is when we start using hospital facilities, surgery facilities, asking them for quotes on the procedures. Because here's the thing.
Is that common?
No, it's not. And that's the problem.
Would they give me a quote if I asked it? It's like,
They're starting to.
Yeah.
They're starting to more and more. And I think that's where there's power in numbers. If one or two people ask you, you can kind of shove them to the side. But if hundreds and thousands of people are asking you, you better figure it out.
And maybe that's a good question for I need some elective surgery or something like that. It's not how much to set my arm, right? And I'm going to go shop around until I find the best deal on that. You recently visited D.C. to testify in front of members of Congress about lowering costs and increasing access to healthcare. How did that go? And what was your message to our elected officials?
That was a very exciting and slightly terrifying experience, but it was great to see all the elected officials. And I walked away really excited to hear them talk in a bipartisan manner. There's agreement across all parties that they want to work together to make healthcare better for Americans. So I was happy with being able to hear that and kind of hear their thoughts and the questions that they were asking. The main messages that we shared was really about innovation and transparency. So as employers, we need access to our data. We need them to hold insurers and healthcare entities accountable to the legislation that they do right. And then from there, we as employers can be innovative and go out and make our own future.
Now, as I recall, while you were testifying, there were people probably not from the looking at this through the same lens as you are, talking about transparency. I think there were some people probably from the medical industry that were saying, wait, slow your roll just a little bit. That be careful about this transparency. What are some of the objections to transparency? Right, there's certainly another argument from their side, and maybe there are some EOBs with a couple of things, but there's a lot of items that go on there. Why does a saline bag cost $5 million or $400, whatever it might be? Yeah. When I was, getting an IV or something.
Yeah, the level of layers of complexity that have been embedded into the healthcare system. I agree. And even when I was there testifying, some of Congress were saying, you don't see us meddling in any other industries like we do in healthcare right now. And it's because there's no insight into it. And it's been overruled by lack of transparency and people just trying to slip in additional layers. And with every layer, there's a cost to it.
There's a lot of players in between me and the hospital and the drug companies and everything else. And everybody needs to make a little bit of money or a lot of money, as you pointed out on some of these things. And that's perhaps one of the reasons why healthcare is so expensive and so opaque. There are so many folks in between you and the provider, whoever's giving you that care at the end of the transaction.
That's a great point. Lots and lots of people involved. And as Ed would say, why can't it just be me, my doctor, and the hospital?
We were, before this podcast started, we were looking at all the healthcare entities, whether it's private or government or whatever. And this chart is huge with lots of dots that all interconnect with everybody else. And you and Ed were making the analogy, at the end of the day, it's the patient, the doctor, and the hospital. Those are really the only three actors in this process. Now, I bet if somebody listened to this is going to say, wait, Dave, now you're not sophisticated enough to understand all the challenge. But at the end of the day, that's who I really I want to deal with. Very, very interesting. What do you see happening in healthcare in the near future, and what do we need to do to get there?
Yeah, healthcare is pretty exciting right now. I can't open up a newspaper or read anything these days without a new legal case or potential legislation that I'm reading about. So it's a hot topic, and everybody's focused on looking at it. Some of the stuff we're seeing from a legal perspective is everything from transparency to employees starting to sue their employer for not giving them great healthcare options.
My goodness.
And so that really starts to get scary. Like, what does that mean? And it should hopefully push employers to be like, I need to be more engaged in this, because at the end of the day, in the private sector, employee and public sector, employees rely on their employer for health insurance, not the government, which is very different than the rest of the world. And so now they're looking at us saying, why aren't you providing me the best option possible? And so I think that's where we're headed. But with that, I think it's going to drive transparency, and I think it's going to drive accountability for healthcare entities as well.
We talked a little bit about transparency. That seems to be a theme running through the conversation we're having. Is getting transparency really the first step in making healthcare more affordable? And then what are the obstacles? If we don't have transparency now, what is holding us up for transparency? I thought there were laws already on the book that everybody should be transparent or something to that effect.
Yeah, there are laws that have come out that started rolling in 2023 around transparency. Patient Advocacy Rights, an organization, put together a recent study on how many hospitals are complying with that. And the last I heard, it was somewhere around 36%. So there's a delay. Like, it's starting, but it's slow.
But if you're in school, that's an F, right? That's 36%. That's not good.
Yeah. So hopefully accountability will start being held on those organizations, and patients will start asking more questions. So you can start to find pricing on a lot of hospitals' websites, but then you have to understand what insurance plan you have. And again, all those layers. So I do think that it does start with transparency. And as an employer, I think the one thing we can do is begin to educate our workforce, educate them and inform them on what their options are, how they do the research, and you'll get more and more people engaged.
You said if you're not as fortunate as perhaps we are to have our own clinic, that one of the things you can do is just ask questions. Mm-hmm. The first question I have: are there any resources available, like on websites or, I don't know, government places to go and start researching what data should I be asking for? How do I go about making my healthcare bill lower?
Yeah. So I think probably the most global one that I can think of is the World Health Organization.
Okay.
So the WHO, you can go online. They have all kinds of patient resources that you can utilize that can help direct you to different types of providers and then what to ask your provider.
Well, that's great information. How can other employers implement similar programs for their employees?
Great question. I think first and foremost, get access to your data. So that's a very simple thing that any employer can do. Understand what is happening on your plan so that you can know what's driving your costs. Every group is different. We have a very young demographic at our organization. Some companies have older demographics. There's different challenges with those. So understand your data and know what's driving your costs.
Ooh, let me pause you right there, right? Because I've heard this debate from you and others in our organization about this is who owns the data? Because what I've heard is there's some laws that says, well, we, as the patient or the employee, I own the data. And yet I've heard that some of the healthcare providers, no, that's proprietary data once they get it and they ingest it in their system. So where do we stand on that?
Yeah. So because we're self-insured, we are the plan administrator and we have the right to that data. I'm not talking about individuals' information. I'm talking about aggregate data that you can use to make healthcare decisions. The individual data, that is the patient's data 100%. But we as the plan administrator have access to the aggregate data and we own that. So
we can get the information on what costs are in different places. We don't necessarily need to know that my name's associated with a particular procedure or something like that. That's what you're saying.
Right. What are your top 5 conditions? What are the top 5 facilities that you go to? Things like that.
Why is that so hard to get? That just blows my mind. As an employer where I'm spending money, right? It's like, I should be able to know. It's like, you know what? Preemies cost us a lot if folks get cancer. So we can plan and run our business in an orderly fashion so that we, can make a profit and be able to pay our bills and keep our employees healthy.
Yeah, I think it all goes back to that price aspect because insurers very much believe that their prices that they've negotiated with facilities are proprietary to them. And that's where their argument lies. But essentially, legislation has come out in 2023 that says it is your data as a plan administrator. So fight for that and please reach out if we can help in some way. We're happy to share our story and the information that can help you get yours. That's
interesting. Really interesting. Michele, any other thoughts before we sign off?
Oh, this has been so much fun. Thanks for having me.
Well, next time we'll talk about symmetrical components or something like that. Thank you so much for joining me. This is fascinating. There's a lot of work to be done here and a lot of savings. I truly believe that $12,000 to $10,000, it just blows my mind. And thank you for all you do. I'm looking forward to our next conversation after you've solved all these problems and our healthcare is much more manageable and affordable. Thanks.
Thank you.
Thank you for stopping by Schweitzer Drive. Join us again as we learn about, explore, and celebrate electric power. For more information about the show, please visit selinc.com/Schweitzer Drive.